Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery
improve.
of Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Samuel Bledsoe, a bariatric surgeon from Arkansas Heart Hospitals, working out of Bryant at the Encore Medical Center. Dr. Bledsoe, thanks for being here.
Thank you for having me. Really appreciate it.
So we're talking about obesity today. What are the most effective treatments for obesity right now?
Yeah. Well, far and away, the most effective treatment for obesity right now is surgery. And of course, it depends on the patient. It depends on the procedure. But we usually expect to lose about 30% of their total body weight, 30% plus 35%. And those are the most effective treatments. And again, it depends on the procedure that's being done and the patient themselves. Some of the other effective treatments that are out there right now, everybody's been talking about the shots, these GLP-1 agonists. Those are also very good. I consider them complementary to what I do. I don't consider them really competitive to what I do. But they are complementary. And again, it depends on the shot, depends on the patient. But you'll have around a 15% total body weight loss, sometimes a little bit less. I would say probably, I don't keep track of this exactly, but probably 75% of my surgical patients have been on GLP-1s at some point in time or another. And they've gotten off of them either because of costs, because of side effects, because it's not working for them for one reason or another. And so the GLP-1 shots are also a very common way to lose weight today. There's other medications that are out there that are less effective. And then, of course, there's the diet, exercise, and behavior modification, which we all should be doing. And no matter what, anyway, just for your overall good health. So those would be the big ways right there.
Well, how do you personalize obesity treatment plans for patients?
Yeah, so it's all about personalizing, right? So, I'm a surgeon, and so we typically see surgical patients and mainly surgical patients. However, sometimes you have to take a step back and look at them from a global perspective and look at them from that 35,000 foot view. So, for instance, if they come in and they're very, very large, the operative risk, it can be quite high. And so what we'll do for those people is we'll try to get them to lose weight to get down to a more reasonable weight so that we can operate on them safely. And we will use GLP-1 agonists for that. We'll use, dietary interventions and exercise interventions for that as well. Sometimes, again, when you're looking at them from that global view, you find out that, hey, listen, maybe your heart's not tuned up quite right. And so we got to back up and we got to build up your heart a little bit so that we can do this surgery safely. And then there's always the usual things that everybody gets as well. It's that the dietary counseling, the exercise counseling, and we even do psychological evaluations on our patients as well. And I think that's also a critical component to it, the psychological aspects, because there's all sorts of things that can slow down your weight loss or make it more challenging for you to lose weight. Just depression and anxiety is almost endemic in our population nowadays. But it's also pretty common for people to come in to have some kind of trauma that's going on in their life that needs to be addressed. It could be childhood traumas, whether it be abuse in their past. There's a number of people who had like a loved one that was close to them, a parent or something, pass away at an early age, and they've been dealing with that trauma. And they really haven't been dealing with the trauma. Or even things in their adulthood. You can go through a divorce, you can have a parent pass away, you can have job loss, anything like that can cause somebody to run to their good friend food in order to stave off, or help out their mood. Then these are the kind of things that the psychologist can help us out with, and I think that's also really important. And that's where the personalization comes in.
What role, you mentioned lifestyle change, diet and exercise. I mean, that is a crucial part of your treatment plans.
Yeah, no question. I mean, if somebody comes in and just says they want surgery, but they're not gonna cooperate in any way, shape, or form with the program, there's no sense in doing a surgery or giving them medications or anything because it's not going to work. I mean, you can't. There's little that you can do if somebody is just determined to eat through their procedure or not exercise or not do anything like that. The problem, though, I don't see that very often. What I do see a whole lot of is people are doing the best that they can, and it's just not working for them. And so whereas before surgery, they're watching what they eat pretty well, they're exercising pretty well, but nothing's happening, and they're getting discouraged. So that person can come in and have a procedure and continue to do what they're doing. And this time they're going to be met with success, whereas before they were being met with failure. the person, I mean, in our society, there's a lot of discrimination and prejudices concerning obesity and people who struggle with their weight. And we love to look down our pointy little nose at people and criticize them or make snap judgments about their work ethic or their self-control. I haven't really noticed that in my practice. I mean, these are people who just struggle with their weight, just like we all struggle with certain things. They just struggle with their weight. They're not less disciplined than we are. They do the same things that we're doing for the most part, or very, very close to it. But they're just struggling with their weight. And so, these people need our help. They need our empathy, and they need an ability. They need a way to address the health problem that's killing them very, very slowly. And surgery is a really good option for those people.
And you mentioned bariatric surgery compared to these other treatments. What are the pros and cons of that? And is that, you mentioned that is still the best option for a lot of reasons?
Correct. So when I say best option, what I'm meaning is it's the most effective option. Now, I mean, obviously, any option it's up to the patient. If we're not arm twisters, we're not going to make you have surgery. But same thing with the medications, and so it's the best option for many, many people, and certainly the most effective option that we have in our tool chest when it comes to treating obesity and its related diseases. So what are asked what the cons of it were. I mean, there's obviously, it's a surgery. And so there's going to be a permanent change that you have associated with food. In the South, I mean, food is a very social thing. And so it can change the way that your social interactions take place at times. Food, it can be a real security blanket for some people. And so it'll change that aspect of it. There's the downside of the surgical risk, which is actually quite small. In fact, the mortality rates for even the most aggressive bariatric surgeries approaches that of gallbladder surgery. So if you know somebody who's had gallbladder surgery, you know somebody, or if you've had gallbladder surgery yourself, you know somebody, or you've had yourself a procedure that's at least as risky as these bariatric procedures are. And then over the long term, you've just got to throw yourself into the program and into the process of, I'm a new person now. Now I am going to try to make good food choices most of the time. I'm not going to tell you can't ever have another bite of cake again. I mean, because truth be told, if my mom brings her pound cake to my house, I'm going to eat some of it, right? So you just got to make sure that what those calories that you're consuming, that they're worth it, and that it's rare and unusual, and that for the most part you're making good efforts to throw yourself into an exercise program as well. I try to tell people, it's like, hey, you're a new person now. Now you're the person that makes good food choices, and you're the person that is at the gym on, if your friends want to know where you are on Monday, Wednesday, Friday at 8 a.m., they know that you're at the gym, right? Because that's how you maintain this health, and you maintain that tool that you've had over the long term. And those would be some of the downsides, I would guess, of surgery. Some of the downsides of the shots is that, they're costly. For some people, they're just non-responders. I've had people coming in on large doses and they can't see a difference. And then there are side effects. Most of them are GI related, and like the nausea, the vomiting, bowel issues like constipation, and occasionally you can get somebody who has a bout of a condition called pancreatitis, and that can happen as well. And so some people, they just can't tolerate the side effects of those shots. But those would be the big downsides to the injections as well.
And there has been the latest research talking about gut health. How does that play into obesity?
Wow. So when you're saying the latest research, that truly is the latest research in what we're doing. And the gut microbiome is getting a whole lot of press because over the past 10 or 15 years, what we found is that the gut, the bacteria that's contained in your gut, in your colon, and in your intestine, it really does cause you to have sort of a symbiotic relationship with them. They need you, but you need them as well. And so in fact, they found this through a number of different avenues. They were doing research into rats and mice, and they found that when they changed the makeup of the different kinds of bacteria in the gut and the GI tract of these mice and rats, that it could oftentimes change their body composition. They also found, I hope that this is okay to discuss. It's just I hope nobody's eating when I'm talking about this, but you can have a colon infection called C. diff colitis, and one of the treatments for that is a fecal transplantation that's done with a scope. And you can basically put somebody's good bacteria into somebody who has defective bacteria, and it can cure that colon infection. Well, one of the side effects of that they've noticed in a small percentage of those people is they can actually change their weight as well. And so they've noticed this happening. So now they're trying to find ways to exploit this mechanism. And they're doing a lot of research into that. They haven't found a good way to exploit that yet. But what they're finding, though, is that the bacteria in the colon can make a lot of changes associated with your weight, and it does it by increasing energy absorption. So there's certain bacteria that'll cause you to increase the absorption of certain lipids. There's an increase in appetite that can take place with certain kinds of bacteria. So you have certain kinds of bacteria that proliferate. Those shots are GLP-1 that causes you to lose weight. Well, they found that that hormone and another one called peptide YY, those hormones are decreased significantly when you have a certain number of and a certain kind of bacteria contained within your gut. And so we could go on and on about it, but the long and the short of it is that the gut microbiome plays a big role in your constitutional makeup, and it looks like that could be a way to exploit weight loss later on in the future. It's not ready for prime time yet, but we're getting there over time.
So you do have some exciting things happening within our state regarding obesity. Tell me a little bit about that and what's ahead for us.
Well, so Arkansas is one of those states that probably between around 500,000 people have commercial insurance, but their commercial insurance either doesn't provide for bariatric surgery or their job does not allow for it. And so in a state of 3.2 million people or so, that's a large number of people that don't have access to this life-saving benefit and life-changing benefit. And so we as bariatric surgeons, we got together and we're like, look, I mean, you don't have carve-outs for a car wreck, you don't have carve-outs for heart attacks or cancers. So why do we have a carve-out for the number one metabolic disease in the state of Arkansas that has so many horrible downstream effects? Why is it that this one disease is carved out as unique and it doesn't get covered with the most effective treatments? And oftentimes it's not just the surgery that's not allowed. It's also weight loss medications or dietary and exercise interventions, in fact, won't necessarily be covered as well. And so we said, this doesn't make any sense to us. And so we've gone to the state legislature. We have a fantastic representative, Lee Johnson. He's actually a physician himself. He's sponsoring a bill that would require that insurance companies and businesses cover weight loss surgery for commercial plans. And it's House Bill 1424. And I would recommend and ask that everybody who's listening to this call their representative and their senator and ask to support House Bill 1424 here in the state of Arkansas. And so that we can get this passed. And I've got good news. Wednesday, I was testifying before the insurance committee for the House, and that passed unanimously. It went to the House floor where it passed overwhelmingly. And so now we're on to the Senate. So we're in the process of it. And, of course, no one knows how these things will play out, but I'm very optimistic about it. And we could certainly would appreciate anybody's support to support House Bill 1424.
So this is talking about changing the landscape of obesity in the state of Arkansas for years to come.
Yeah, that's correct. And the sooner you get on it, the better. I mean, I appreciate seeing anybody, but it seems like I see way too many people who are in their 60s who have an insulin pump, who've had 3 heart attacks, and they're on 4 different blood pressure medications. And I'm happy to help those folks as well. The people I get really excited about, though, are the people who are in their 30s who were just diagnosed with diabetes and they're on metformin. That's the person you can really do some change for. In fact, a lot of research suggests that you can add a decade onto that person's life. I'm not talking about just years. I'm talking about good years onto their life. Everybody wants to live good, long years. And those are the kind of years you can add on to that kind of person because it's so early in the process. You haven't had 3 decades of the insult that this hyperglycemic environment brings, and so you haven't had that contamination. And instead, we can get on it early and we can get on it quickly, and then you can really make a person change a person's life for the better, and not just on the diabetes front, but also on the weight loss front. There's not the wear and tear on the joints, and just the being able to be involved in your life more. I mean. One of my favorite things is when somebody comes back in and they've had something in their life that they haven't been able to do for so long or they enjoyed, and now they're able to get back into it. I've had patients who love to canoe and they've been able to get back into a canoe. I've had a patient one time that said she wanted to go parasailing and she couldn't do it because of her weight. Or I had a guy who loved to get on roller coasters, but he couldn't bring the lap belt down. And so I even got one patient, I lost her to follow-up. I wish I could find her, but she liked to horse ride. She was a champion barrel racer in her youth. And she's like, I just want to get back on my horse, And those are the kind of things that get me really excited. It's it's the medical benefits, the diabetes resolution, the weight loss. But man, when you see somebody who now for the first time, they don't have to ask for that seatbelt extender on the airplanes. They're able to do something they haven't been able to do, get down on the floor and play with their kids or their grandkids or go on a walk or a hike with their family. I mean, that's what life is made of. It's those things, those interactions you have with your loved ones and your relationships that now you can be more involved in your life. Man, that just gets me excited. And so I look forward to helping out those people tremendously.
Well, Dr. Bledsoe, thank you so much for talking about this and your passion that you have for your craft shows. And so thank you for sharing information about what the future looks like for the state in obesity and treatments. I appreciate you being here today.
Well, thank you so much. If anybody wants any more information about our practice, it's at bmi.arheart.com, and I'd be happy to take any phone calls from anybody or answer any questions from anybody that may have them.
Thank you so much. That's it for this episode of AFMC TV. Thanks for watching and have a great day.